Because do you guys know?
I don't know like all the details about what the difference is. I know that.
I feel like I don't even have IBS. So that's something else. I'm dying.
Hi, I'm Ishmael.
I'm Rachel.
And this is Dr. Carrie Mitchell again.
Hi, guys.
This is
Help Us.
So today we want to talk about the differences between IBD and IBS. Rachel has IBS. I have IBD. And a lot of people don't really know the difference between the two. And to be honest, I know what I've got. I don't necessarily know all the details of IBS, and I'm sure it probably goes both ways. Mm-hmm. You're pretty well versed on what you've got, probably not so much what I've got. So Carrie's going to teach us a little bit about what we both have.
Yeah. Okay, so IBS is interesting because it's a bit more of a diagnosis of exclusion. So it's like we've done all the tests, we've done scope, we've done imaging, we've done blood work, and we can't find anything, so you have a syndrome. So it's called irritable bowel syndrome, which is literally just a description of what's going on. Your bowels are irritable, which is not fun. And so what we find is that when we look at blood work, it looks fine. When we look at the insides of your gastrointestinal system, it looks smooth, it looks fine. We don't see generally a ton of blood in the stool, so we're like, well, that sucks, good luck. With IBD, it's a little bit different because it's a disease that has structural abnormalities, right? So at the start, you were like, something's up with my gut, let's figure it out. And so you probably started with really easy tests, and then you moved into actually doing a scope and getting your final diagnosis.
I don't really remember any easy tests.
Would they have done like blood work, or you did food sensitivities?
No, blood work first, and that was kind of...
And you were like, okay. So sorry, like if someone comes to see me in the clinic, I start with like, let's check off some of the easier boxes. Is it a food sensitivity? Is it a lack of digestive enzymes? Is it, a dysbiosis of good and bad bacteria? And then if they continually don't get better, if they do have more aggravated symptoms like weight loss or blood or excessive mucus in the stool, then we say, okay, it's time for imaging.
Just to clarify though, when I first was diagnosed, I hadn't gone to see a naturopath yet. I'd only seen my family doctor, and that wasn't something that they kind of looked into. So it was just mostly blood work, and then it went straight into a colonoscopy. But if you do go to a naturopath, there's a lot more extensive testing that they'll go through and look at before they just throw you into a scope or anything like that. Yeah. There's a lot more levels before they throw you into those tests.
But I mean, for you, that was the appropriate choice, which is awesome. Is that you got a pretty quick diagnosis. So IBD is inflammatory bowel disease. So the difference is yours is an inflammatory condition and IBS isn't. I still think there's inflammation in the system for sure, but what goes on in IBD is that for some reason, we don't always know why, there's massive inflammation within the gut. So colitis is generalized to the colon, and then Crohn's can be within the entire system. And what can happen is the inflammation can cause lesions or ulcers on the gut, which would cause more mucus or bleeding or really intense pain.
And then polyps or something that can kind of develop in that too?
Yeah. And IBD generally needs to be treated, whether it's with natural means or with medications, to really keep the inflammation down. Otherwise, it can move on to more serious conditions. Whereas IBS, it's not fun, but usually you're just stuck with gut rot and a really unhappy digestive system, but you don't often move towards more serious conditions in the future. So they both can start to present very similar at the start. So bloating, like you guys know. So bloating, an alternation between constipation or diarrhea, lots of stomach aches. Both can have mucus in the stool. Generally, blood in the stool is a little bit more straightforward to IBD, or something else going on in the gut, well, I say blood, but I mean either dark stools or actual blood, which can be hemorrhoids from constipation too. So it can kind of be a mixed bag, which is why it is important to talk to someone and figure out, with testing or with scoping, we can find out exactly what's going on.
So for people who have IBD, and let's say it's, for me, like I have colitis, is it ever possible for it to develop into Crohn's if it's not treated, or are those two separate things?
Yeah, they're generally separated.
Yeah?
Yeah.
Okay.
And then with IBS is interesting because what we find is, in my opinion, it's not really a diagnosis of inclusion, and I think that's where naturopathic medicine really shines. Is I think that when you have IBS, there's usually like one of 5 things off. So the first thing is food sensitivity, which we talked about last week. The second thing is a lack of digestive enzymes, so whether it's pancreatic enzymes, bile enzymes, or stomach acid. So not having enough of the juices of your gastrointestinal system to break foods down appropriately. I often find that there's some modicum of dysbiosis, so good and bad bacteria. So we talk about probiotics a lot, and some people do really well on probiotics and some people don't. So there's a situation that I think that there's kind of easy dysbiosis where for some reason, whether it's like too much sugar in your diet, recent antibiotics, lots of stress, travel, that your flora is a little bit imbalanced. And that's when people say, oh, I took a probiotic and it really works. I feel great. Sometimes you need to take it for a month. Sometimes you need to take it longer. And then there's another condition that's more of an emerging condition. And it's called SIBO. So it's called small intestine bacterial overgrowth. So most of our really good microbes are in our colon or our large intestine, but when we see that there's an overgrowth in our small intestine, we'll often get a lot of symptoms of IBS, and we're finding in studies that a ton of people with IBS have SIBO. And so that treatment are the patients that come in and they say, I feel horrible whenever I drink kombucha, whenever I have kefir, when I eat yogurt, or when I take probiotics. So like I said, when people come in, we'll usually start the investigation, and sometimes they're on their own probiotic, or we'll try a probiotic, and they're like, I felt much worse on that. And that's kind of like our light bulb of saying maybe there's too much bacteria in the gut. The fourth thing that I find in IBS is too much or too little. So sometimes it's too much magnesium or not enough fiber. Too much, like some vegetarians have loose stools because they have so much fiber in their diet, and that's just normal. And then sometimes if we don't have enough fats in our diet, we'll get constipated. So these are some of the ideas of, if you're not getting enough essential vitamins, minerals, and oils, or if you're getting too much sugars, meats, proteins, gluten, not enough fiber, that can cause like a tendency towards constipation and diarrhea, bloating. And then the fifth one is stress. So we know that stress is a huge part of an IBS diagnosis.
All of those.
Yeah, okay.
And it doesn't really help that usually when you're going through those things and you're not feeling great, you tend to feel stressed, and then the more you get stressed, it's kind of like this vicious circle.
Because it's something so important, like we eat 4 times a day, depending on who you are, right?
Or you just snack all day long like us, and eat meals.
And I have patients who are afraid of food. They're like, I can't go out anymore. I don't know what to eat. I'm just not going to eat. Or I know that I can eat chips because chips don't bug me, so I'm just going to eat chips or potatoes or
But then
rice.
you're definitely not getting all the nutrients you need either if you're only just eating chips.
Eating one thing, yeah. So it's there's definitely like a psychological component to it.
Going back to what we were talking about with probiotics, I've found in the past 3 years, while I've been going through all of this, certain probiotics I find work really, really well for me, and certain don't.
That's a good question.
Yeah, like there's a makeup of probiotics. What is it that can kind of react not so well and really well with things? Is it just they focus on different areas of your body?
Well, probiotics is like 100 million types of little probiotics, right? So some we found should be in different areas of your gut. Like we have little microbes everywhere. So you have microbes in your ears, on your skin, in your oropharynx, in your tummy, wherever. So what we find is that specific ones can treat specific things or like their home in specific areas. And we also find that not all probiotics are made equally. So we see a situation where some aren't human strain. So if you're taking a bovine strain, like yogurt is all well and good for some people, but it's a bovine source. It's a dairy.
Yeah.
It's like those. It's like the mama cow's biotics that you're eating. So it needs to be human strain. So something that lives in our body. Some people like multi-strain. Some people like to do a probiotic with 1 to 2 strains. And it's also not a heavily regulated system. So I find professional brands will guarantee that you're getting the amount on the label. But if you're getting something from, I won't name any names, but like from just over the shelf
That's just like an acidophilus and
yeah, what they said it was, or that doesn't have enough. And so it is important. And then dose is important. So you can get 10 million, you can get 12 million, get 60 billion. Sorry, I'm saying million. Billion.
Yeah.
And so it is really important to, try a few, because some things that work for some people won't work for others. But also, follow a few golden rules. Yeah.
Is it smart to kind of switch up your probiotics every once in a while? Or if you find one that works for you, and it's not like I'm on probiotics all the time, but every once in a while when I do need to go back on them, it's like usually a 15-day stretch that I'm on these specific ones. Is it smart to kind of change them up every once in a while? Or if that works for me, is that one that I should kind of stick to?
Yeah, I mean, if it works for you, I'd say stick with it.
Right.
Yeah.
Yeah. Do you find with your like IBS and stuff, when you've taken probiotics, has it kind of helped a little bit?
Yeah, I think so. I mean, I started taking probiotics since I had
food
poisoning.
Yeah.
Since I just had food poisoning. So my stomach was doing really well before that.
Yeah.
I've been trying to like balance my hormones. So I think it may have kind of been more hormonal for me. And yeah, I was doing really, really well. But then I got food poisoning and it threw everything off. So my stomach's been kind of out of whack. So I've been taking probiotics since, and they're 50 billion per capsule.
Okay.
And sometimes I'm taking 2 of those.
Oh, wow. Does it cause you to lose stools at all?
No, not really, because I've been on such a boring diet since I had food poisoning. I've been eating like bread and rice. And so, yeah.
The Bratz diet.
Yeah.
So actually, cycling back to the SIBO, is that it's a good opportunity for you to kind of rebalance right now, because food poisoning can actually be one of the causes of SIBO.
Great. Yeah. So I have that too. Well, I probably do. But yeah, I've noticed that, the probiotics do help me.
And do you stick to one kind every time, or do you kind of like dabble and try different types?
I try different ones.
And have you found any that work better for you? Like I know people are really interested in hearing what's kind of like worked for us in the past, and I'm trying to just find out, like, do you find there's been anything?
There's one that I really like that, I don't know. It's one that is stable on the shelf as well, but they do sell it in the it's refrigerated.
Yeah.
But I like that one because you can take it traveling with you. And I find whenever I'm traveling,
It's a capsule?
Yeah, it's a capsule. My stomach bothers me a lot when I travel, so I do like that one.
But that's one that works for you, that you found worked well.
I like that one.
Awesome. For myself, I know I've tried like quite a few different ones. One of the ones, it's like a powder base. It comes in a pouch, comes in a little box, and it's a 15-day little thing. It's called Probiotic 225. And so you just, every morning I would open it up, put it in a cup of water, mix it up, drink it. And I found that one really rebuilt my stomach really well. It kind of fixed any kind of, not inflammation, but just discomfort I was having with stool, even bloating. It kind of
The edge off?
took the edge off a little bit. So that's one that's really worked well for me. And I was on antibiotics just 2 months ago for 2 weeks after I got my wisdom teeth out, and I used that afterwards, and that really helped in like the healing process and just kind of rebuilding that flora and making it easier for me to eat food and absorb something, I'm assuming. But
Yeah.
yeah.
One of the foundations of naturopathic medicine is individualized treatment.
of
And
course.
so I find that everyone comes in with a different bag. So
Yeah.
a vegetarian diet would be very different, like even with the subsets of what's going on symptomatically. I find avocados are great for everyone. It actually has a ton of fiber and magnesium that we didn't know. But I was always like, oh, tons of fat, but it actually has a ton of fiber in
And
it
they're
as
good
well.
fats, right?
Yeah, healthy fats, yeah. IBD is a little bit harder because some of the things that I love, like nuts and seeds and berries and, superfoods, sometimes you can't tolerate quite as well.
Yeah.
So usually I find when we're dealing with anything digestive-wise, and you might disagree, is that especially in winter, cooking foods and allowing the food to be processed a little bit when your digestive tract is struggling is a really good way to assimilate some of the nutrients out of it. Every food is a little bit different, where you'll get some vitamins and minerals when they're raw and then some when they're cooked. So it's nice to have some raw foods and some cooked foods. But like a big old like chicken noodle soup, maybe the noodles are gluten-free or you do rice as a base. But when you use like that stock can be really good, and then tons of vegetables, and then adding, well, do you do well on garlic? Yeah, so garlic's another great superfood for a lot of people.
It's true though,
Yeah.
because like everything, like it is so individual based. I mean, even as far as treatment goes, I find for other people that I know that have IBD, I can tell anyone at home like what I'm doing, but it doesn't necessarily mean what I'm doing that works for me is necessarily going to work for you. It kind of ends up being that between you, your doctor, and just your own attempts. Like you're going to kind of figure out what works for you.
Yeah.
Because everybody's story that has IBD, their journey has been like completely different. So it's really hard for me to pinpoint exactly what is going to work for you, because I can talk to 6 other people with IBD on a daily basis, and I'll hear from them what they've done and what's worked for them, what hasn't worked for them, what meds have worked for them, what diets have worked for them, and it's completely different across the board. There's like zero consistency. So it makes sense that when you go see a naturopath that it's very individual based. Yeah.
Yeah, and today we were talking, should I do bone broth? Should I do beef
Meat
stock?
stock, yeah.
And I said, well, maybe the first thing you do is pull out dairy again. Because I think that sometimes it's a mix between what you add to your diet and then what you pull out to kind of see where you do the best. And I think both of these conditions are very multifactorial. So some gastroenterologists don't really think that diet has a ton to do with it, where I would absolutely disagree, because different foods have different properties. Some are more acidic, some are more alkaline, some are more inflammatory, some are less inflammatory, and I find that if you can give your body the foundation, then that's a really good start to being able to tackle the hard work of healing those lesions or decrease or being able to tolerate a medication, right? And then because these conditions are so multifactorial, often we find that, I always think of it as like a cup. So if we have your underlying condition, so maybe you have your IBD, and then stress, and then we're not getting as much sunlight, and then maybe you have a deficiency, that maybe dairy or sugar or eating out or alcohol will overflow your system that week. Whereas if it's summer and you're exercising more and you had a great diet all week and you had the week off, and then you go to a massive party and you overdo it, you might not flare up. So it's kind of that situation where
That makes sense.
yeah, you don't always have to be perfect, but I think you can find out the time and place of when it's easier to flex on the diet.
Yeah, some good info.
Yeah.
But one thing that I definitely noticed in the past 3 years is because originally I had just focused mostly on, what my GI was saying and stuff, which was great and it works to some extent. But I found that once I did start combining a lot more of like the naturopathic stuff, there was a lot of things that, like the foundation of my body, like it was just kind of rebuilding a lot of that stuff, which was making it easier for me to take on a lot of those Western medications that can be really hard on the system and can cause a lot of different side effects and this and that. And so I found that doing the naturopathic stuff really rebuilt this foundation that I definitely was lacking before.
Yeah. And most healthcare practitioners love a blend of all of our medicines, right? And using Western medicines and traditional Chinese medicine and acupuncture and botanical medicine and foundations of diet and exercise. And, you know, when we put those all together, I think that's when we're really successful.
Yeah. And I think when you kind of find out that you have IBD, you find out whether it's from like your GI or anything or after a scope, no one really, when I was going through it, I didn't really have anywhere to look where I could learn about the naturopathic stuff or anything like that. So I was kind of just on this one track where I was focused heavily on doing exactly what my GI said, which I'm still doing, but
you needed more support.
I needed more support, and I think once I got onto the naturopathic stuff, the combination, just like you were saying, really like rounded the whole experience out to make it much stronger, and kind of what things that I was losing and lacking, they were being made up on this side. So it was nice.
And I think one of the best parts of our practice is we have more time, because it's a different form of medicine and an appointment system, is we get time to explain it. And like one of my favorite things is being like, do you know what's going on? Like, do you understand what this diagnosis is and what this means? And do you understand your body? Do you know what the gastrointestinal system looks like? So one of my favorite things is teaching, as well as to say, you know, there's a lot of empowerment in knowing your body, understanding your symptoms, understanding, you know, what you can do to feel better. Yeah.
So that we're gonna wrap it up, Carrie. But we'd like to thank her again. Thank you for joining us again this week. Definitely a lot of great information. It's important that we kind of learn our bodies on an individual basis and what works for us. So I think it's some great information for you guys to start off and kind of hone in on your own journeys a little bit. So Rachel and I would just like to thank you for coming by again. And check us out again for the next episode. Make sure to like and subscribe. And thank you.
Bye.
Bye.